Okay, so I've gotten a few comments, not fully grasping what withdrawing from the World Health Organization will do to us. So I went through all the websites for the FDA, NIH, and CDC to see exactly how we will be affected. Let's start with the FDA. Drug and vaccine systems, distribution, testing, manufacturing will all be affected. Food recalls, detection of substandardized or inferior products or falsified products. So product safety out the window. In vitro testing, so cancer. And any other testing that requires a blood test or a sample will be affected. NIH, or medical research, about to go out the window because there is a lot of collaborative international projects that's going to be affected, disease prevention, health improvements, and they're going to experience massive funding cuts. In terms of how much each agency receives from who, FDA receives 8.4 billion, NIH receives 47 billion. Now let's get into the CDC. So with the CDC, that's the Global Outbreak Alert and Response Network. So it addresses and alerts public health crises, deployment of humanitarian efforts, event-based surveillance, identifying and tracking diseases. It is also responsible for training programs in epidemiology and public health intervention networks. So essentially the one that is very dependent on any data we get from World Health. They receive 24.9 billion. So while we contribute 1.284 billion, we're actually using the vast majority of this money for our own work. It is only a fraction of what we use. It's barely scratching the surface. As far as COVID, the US leaders were notified by World Health in November, December 2019. However, the people were not notified until March. Let me say that again. We were notified November, December 2019. Trump did not notify the people until March. This is why I was saying withdrawing from the World Health Organization would be catastrophic for the United States. Because all of our medical testing is about to go out the window, medical treatments out the window, food recalls out the window, making sure our products are safe out the window, global surveillance out the window. You're going to have to subscribe separately to get any data from World Health, any information from World Health.